The South Asian community in the U.S. faces unique challenges as they navigate both physical and mental health issues in later life. According to the CDC, South Asians are at high risk for diabetes and cardiovascular disease. In response, Dr. Santosh Kumar founded an organization in Chicago dedicated to providing culturally relevant resources that not only address these health issues, but also support the overall well-being of South Asian immigrants. What did you feel like when you first got here? Was there any culture shock?
I was totally shocked and very disappointed. I was very homesick in the sense because in India, I was around the people all the time, as an attorney, as a professor. But you have to go through whatever you have to go through. When I came here, I had to learn everything. So I learned my computer degree. And then not only that, I went further. So I learned the designing here.
So what prompted you to start this organization?
Truly speaking, that organization is born by the concern and the pain which I felt for my community. One day I was coming from the court and I saw an Indian couple sitting on their doorstep and I stopped my car and went to them. Okay, what is the matter? It was a September month, which is a cold here. And they could not open the gas. So they could not cook the meal or tea even. So I opened their gas with their permission. And then they make the tea. And the tears were rolling from their cheeks. I couldn't tolerate this. I couldn't bear this kind of pain. We are not here for that. So I talked to my husband and said, something has to be done. Then he said, what do you want to do? Like, I want to do something and open organization. Though I already opened my legal practice by that time. But he said, okay.
Dr. Santosh Kumar went on to lay the foundation for Multicultural Asian Family Services, driven by the goal of fostering a sense of community in the United States that has been severely lacking for South Asian seniors in particular. And what about food? Because in our culture,
what you touched that. That is the core of our people. Our people cannot eat British or any other food except their own food. That is why I started my meal program. I think we are running this last 30 years now.
Because food is such a big part of our culture, they're also very culturally specific. So how do you manage that?
Because generally people are vegetarian. Some people can eat meat. So I give one day, a Friday, as a biryani day. We call it biryani day because we give them biryani or chicken.
And it's known fact that unfortunately, a lot of South Asians are also at risk for many health problems like diabetes.
Very, very much. One daughter bring the mother to our organization. I say, I don't want to do anything. Take wherever you want to take. Her blood pressure was 200 at that time. So I have to find a medical help for her, place her, provide food, shelter. I have to prepare all the beddings for her because nothing was there for her.
Metropolitan Asian Family Services provides South Asian seniors with tailored health services, balanced meals, and lifestyle programs, helping them stay connected, healthy, and supported in their communities. What are some of the impending issues that you think that your organization, other organizations can address when it comes to South Asian needs?
Housing. Senior housing we need so badly. Transport and housing because of their lack of driving capabilities. And they do not have a secluded houses for themselves. So where they can get the same the Indian food. There's no facility here.
What piece of advice would you give other cities and other organizations?
CLEAS is very important. Coalition of Limited English-Speaking Elderly Organization, helping so beautifully all the communities. I think they should take example of that, replica they can have. What we do, we create India for them. We create Pakistan for them. We create Nepal for them. Observing their festivals, their rituals, so they feel at home.
According to the U.S. Census Bureau, Asian Americans continue to be the fastest growing racial and ethnic group in the United States. As a new generation steps forward, her sons carry on the family legacy, committed to serving and uplifting the community. This is a perfect example of intergenerational community care. What would you like to say to other organizations?
To the organizations that want intergenerational, we have to make sure that we're keeping the old with the new. So the culture with the times. Keeping both of those at peace, which is hard to do, will blend the history with the next generation. With the advent of all these new technologies like telehealth, we've done digital learning through learning management systems like LMS. We have a new software company that integrates all the home care aids in one platform. They have a direct chat ability to the clients and to the caregivers. Sooner or later, we're going to add in AI. So we'll understand or help the supervisors understand what's going on with the clients.
I think that the future of healthcare, and especially the way that South Asians and maybe Asian culture, or a lot of the cultures like us, think about it, we want to make sure that we take care of our parents so that they can kind of take care of themselves until the absolute end, I guess. So we want to make sure we provide more community, like our seniors put on plays, do dances at fundraisers. Then when you stop doing those things, when you stop working, when you stop having fun, that's when it declines quickly. So we want to make sure that that doesn't happen either. I think our saying is not adding years to life, but adding life to years was one of the biggest MAFS taglines. I truly believe in that as well.
Dr. Santosh Kumar's legacy is woven into the very fabric of her community. Through her family organizations like MAFS and resources such as AARP and CLEAS, she has touched countless lives, building a bridge of compassion and care that endures. Her work reminds us that true strength lies in our connections to each other. Her life is a testament to the power of community and serves as an enduring call to unite in support of one another, creating powerful cords of connection.